Hey guys, welcome back. This is Dr. Hub. Today we look at the validity and it is going to be of the screening test. So first we need to know that the validity or the accuracy. So this is of a screening test. It depends upon the sensitivity. It depends on the sensitivity as well as the specificity. Next is it also depends on the predictive accuracy of the test. It includes predictive accuracy of the test, and it represents the closeness to a true value. Represents the closeness of true value and also the actual value as well as the actual value. So these tests, they are inherent properties of a screening test. They are inherent properties, and this is going to be of a screening test. We need to know that the PPV and the NPV, they are nothing but it is dependent on the prevalence of the disease. So they are dependent on the prevalence of the disease. And the sensitivity and the specificity, they are independent of the prevalence of disease. They are independent of the prevalence of the disease. Now let's draw a diagram so that we are able to understand what we are going to do it further. So diagram, we have the disease. On the other hand, we are going to compare it to the diagnostic test, and as we know, it's going to be a present, absent, and it's going to be positive here and negative. So let's draw a square. This is going to be TP, that is true positive, and where the disease is absent is going to be the false positive. So it is the false positive, and here it's going to be Fn, that is a false negative, as well as a true positive. Now let's look at the sensitivity, and here it is going to be the specificity. So it is TP divided by TP plus Fn. On the other hand, it is going to be Tn divided by Fp plus Tn. So it's TP by TP plus Fn, and on the other hand, specificity is going to be the Tn by Fp plus Tn. So here on the other hand, we are going to get the positive predictive values. So what are the positive predictive values? It includes the TP divided by TP plus Fn. On the other hand, the negative predictive value, this is going to be the Tn divided by the Fn plus Tn. So this table is very important for formulae. So now let's individually break down. So looking at the formula, there is a sensitivity. This is very important. So in case of sensitivity, it is nothing but the TP divided by TP plus Fn. Now moving on to the specificity. So specificity is nothing but the Tn divided by Fp plus the Tn. Next is we look at the PPV. PPV is nothing but the predictive value. This is the predictive value of a positive test. So here there is nothing but it is TP divided by TP plus Fp. TP plus Fp. So everything is positive here. Then we move on to the predictive value, and this is of a negative test. Predictive value of a negative test. This is nothing but NPV, and here it is Tn divided by Tn plus Fn. Now let's look at the next one, that will be the percentage of false positive. The percentage of the false positive. So this is going to be by divided by Fp plus Tn. Next is percentage of the false negative, and this is going to be the Fn divided by Tp plus Fn. So another finding we need to know is that the PPV, it varies directly with the prevalence. So it varies directly. This is in case of the prevalence. Next is the NPV. The NPV, it varies inversely. It varies inversely with that of the prevalence. So this was all about the validity of a screening test, and we saw some very important formulae. To learn and grow daily like this, please do subscribe.